Hello everyone, and welcome to this session of learning for postpartum assessment form. I am Miss Kinan. I'm going to help you go through this session. The objectives of today are to know how to use the postpartum assessment form and to be able to have the confidence in using the form during clinical practice and assessing for postpartum women. So as we know, once we are choosing a patient as our case study, we need to have the initials of the patient's name, the age, the marital status, the religion, their job, the last educations of the mother, and the address. As well as we also assess the husband or the partner about their initial, the age, religion, job, education, and also their address. And the next step is to have the subjective data. We begin to do the assessment. We assess the chief complaint. We assess what's the problem with the mother, as she is now a postpartum mother. We can write about uh, um, her gynecological history, how many gestations she has, how many parties she got, and then how many live child she got, so abortion she got. So then we write everything over there, and then we also assess what's the problem that she's facing now as a newborn postpartum mother. Then we assess the history of her menstrual cycle. So we ask about her period, the first time when she got it, and how's the cycle, whether it's 24 days, 25 days, or 26 days, and is there any problem that she faced during the menstruation, and if she probably has dysmenorrhea during the period, and whether she's performing a vulva hygiene, how's the vaginal discharge, whether she has infection, whether she has a type of infection on her period or after period, and what's the color, how's the smell, whether she is having hemorrhoids as well, how's the degree of the hemorrhoids, where's the location, does the hemorrhoid cause her to have bleeding during poop, and how's the pain, is there any pain. Then we also assess if the mother just have hemorrhoids during the pregnancy, or was it already there before the pregnancy. Because it's already there, then it means it won't disappear. But if the hemorrhoids appear during the pregnancy state, then probably the hemorrhoids will have the chance to disappear after delivery. Next, we assess the history of pregnancy, delivery, and postpartum, including the current pregnancy that she has. So we assess if this is the third child, so we will have number 1, number 2, and number 3 filled. The data about the children, you will have the date of birth, the age, the pregnancy age, was it 35 weeks, 36 weeks, the type of labor, whether it is vaginally or through surgery, and where the operation or the delivery is happening, whether it's with the midwife clinic or at the hospital or probably community health center, and who was the helper, was it a midwife, a nurse, or an obstetrician as the helper. And then we have to write the information about the baby, what's the weight, what's the height, and what's the condition at birth, does the baby have normal Apgar score, or the baby needs resuscitation, and how is it during the postpartum period, whether the mother have giving birth and then the baby develop jaundice because of hyperbilirubinemia, and then the mother needs to put the baby in their phototherapy, and whether the mother breastfeed the baby, or the baby is having formula, or the baby is just only with breast milk all the time until today. So we write everything about the pregnancy, delivery, and postpartum history inside this table. Next, we ask about the history of past systemic disease. So this will be all the history of medical conditions that the mom has, probably heart problem, kidney problem, asthma, hepatitis, diabetes mellitus, hypertension, epilepsy, or even like a fracture somewhere in the past, or probably scoliosis problem or back pain problem. So we write everything about the mother's health in this section, as well as the family history of disease. So if the father or the grandfather has history of hypertension or diabetes mellitus, so it means that the mother probably will have the chance to develop hypertension and diabetes mellitus as well. And if the mother and the father, or the mother the grandfather grandmother have the history of allergies, we also write it here to make sure that we trace the correct health status of the patient for precaution to this current condition. Next one, we write about the daily activities of the mother. If the mother is housewife, if the mother is a worker, company worker, or anything else, then we write here what's the job, how's the sexuality life, how's the bathing, the diet, rest and sleep pattern. So how many times the mother eat a day, how many times the mother shower a day, what time the mother sleeps, what time the mothers wake up, and how's the sexual relationship between the father and the mother. We write everything here so we can assess any problem that possibly happening with the mother. The next one is we do the physical examination for the objective data of vital signs. So remember that we put this into a table. So we'll have the blood pressure, pulse rate, breathing, respiratory rate, and then temperature on it. So we will have every single thing, as well as pain, and then also the height and also the weight under the table. So we will know what's the current physiological data of the patient, as well as we mentioned if the patient is having pain. So we also mention about the pain and what we do about the pain assessment inside this physical examination section. The next one is we do about the face. So in the face, we try to see if there are any edema, yes or no, how's the conjunctiva, how's the sclera, how's the chest, is it symmetrically, not symmetrically, is there any breast problem like a mastitis, not mastitis, but a blocked duct that you can feel, and whether there is any breast milk that's coming out, colostrum that's coming out. So because we are going to initiate the breastfeeding to the mother, so we check about that on her chest, as well as we check her waist. We see if there is any pain present on the mother, as well as extremities. So we check extremities of the hands and finger, extremities of the feet, and also the calves, whether there's a problem there for deep vein thrombosis, and then how's the limb, is there any varicose present, and does she still have patellar reflex after delivery. So that's what we need to assess on the extremities. The next one, we assess the abdomen. As we know, the mother just delivered a baby, so we will see how she was delivered the baby, whether it's through cesarean sections or vaginally delivering baby. So we check the scars, we check if there are any diastasis rectus abdominis, we see how's the belly shape, we see if there is edema, we assess the fundal height of the patient, and we see if the patient still have contractions, and if the contraction is consistency or contractions just stop. So we check all about that here, as well as if we notice any stretch mark or any other problem that considered as postpartum problem, then we can also put the data inside the section. Next one, we also assess about genitalia. we ask the permission for the mother to open their pants to see the vulva and the vagina. We see after vaginal hygiene. If the mother is having a C-section, probably lochia won't be so much. And then if the mother is having episiotomy, we can see the rida, if there's any redness, if there is any ecchymosis, if there is any other problem that we can see. And then we can also see if there's any varicose vein, any wounds, any redness, any pain, and if there's any scars, and whether the episiotomy is the first one, or because this is the third child, then also the third episiotomy. So we will be able to see how's the genital conditions of the mother. Next, we do the psychological aspect. So we assess whether the mom is already having taking in, taking hold, and let go. So we make sure that the mother emotional conditions is being assessed here. We also ask for social history, whether the mother is married or not married, if married the first time, married the second time, how many years, and if this pregnancy is planned or unplanned, and accepted or not accepted. We can also write about the family here, about the support system that the mother got. Probably the mother-in-law is here, the mother is here too, so where those people are really supportive during postpartum period. Next, we write about the spiritual aspects or belief about the understanding about postpartum process. For example, if the mother is from China, they have the certain rules that they cannot go out and shower until 40 days. So we need to understand that. If the mother is from Japanese, we also understand that they need to drink like certain drinks, as well as consume and do body care, that the one that according to their culture and their beliefs, as well as religion based. Probably they cannot eat pork, or they don't receive blood product transfusion, so we have to write it over there. Next, we go to diagnostic tests or laboratory tests. Here we put it in the table as well. We write down what is the results of the hemoglobins, blood type, hematocrit, and rhesus study. So we write it in the table in case we were doing a series of checking hemoglobin, while the first one may be normal, and then after delivery is a little bit low, and then the doctor order blood transfusion, and we're going to evaluate how it is. So we write it inside a table, so we will be able to understand how's the fluctuations of the hemoglobin. Then we write also in another table what's the therapy given to the patient. For example, the patient received painkiller, or the patient received vitamins, or the patient received medicine to increase the milk supply. Then we write it there, how many is been given, when it's being given, and what's the use of the medicine. So we also, as a nurse and midwife, we understand what is going on with the patient. Now, after we filled in all these things, we move on to what we call data analysis. So in data analysis, you have basically a table of your subjective and objective data. Then you choose the etiology that match it, and then you choose the nursing problem. And then don't forget that we write the whole nursing diagnosis in PES format, which is problem, etiology, symptoms. So we write according to condition. And you have to understand that whatever you put in data analysis needs to be present in your assessment form. So make sure that you are making sure every single thing that you write in assessment is also being presented here in the data analysis table. Next is about the nursing diagnosis. So as I mentioned before, you have to arrange the nursing diagnosis with the format of PES, problem, etiology, symptom. And then here, you really need to arrange or prioritize according to the chief complaint and according to the help that we are going to give to the patient. For example, let's say my mother that I'm assessing has the third child, and this third child coming from the second marriage where the father did not agree that the baby should be there, but then the mother carry on with the pregnancy anyway. So then once the baby is born, the mother built like a lot of anxiety. She didn't want to see the baby. She didn't want to touch the baby. The baby kept crying and the nurse has to help her. And it really looks severe that she is tearing up because of the conditions that she got no family support to support the baby. So from that assessment, probably we can choose the nursing diagnosis of anxiety related to uncertain future. So we put that here in the nursing diagnosis. Then we prioritize every single thing. Once we have the nursing diagnosis, we begin to formulate the nursing plan. So what we want this anxiety to happen, what's the objective, what's the expected result that we want the mother to have. We should write it according to SMART criteria, so we will make sure that the mother will be helped by our care. So for this, probably we will say that we will do implementations collaboratively with psychologists inside the hospital to give a counseling service to the mother. So we can try to write it down here, the nursing diagnosis, as well as mentioning what's the expected result and then the action plan that we want to do. So in the nursing implementation, we can write what we do regarding the condition. We need to mention that there are 4 types of implementation or intervention or plan, which is observation, independent nursing action, collaborative actions, or health education. So we try to see if this is anxiety, what we can do. As a nurse, we can make sure and provide assurance, but then we also can do a collaborative treatment by providing a counseling service for 1 hour to this mother. And then after that, we can also see how's the response of the patients, whether the patient is satisfied with the counseling, whether the patient is not satisfied with it. So if the patient is like really satisfied, we can write there that the patient's now gaining hope, knowing what to do in the future, and know what plans that she needs to do to raise the children well. Next, we do the nursing evaluation. So this is the last step of nursing process. So in here, we write down what do we do, what did we do to the patient according to the things that we've done. So always write the things that you have done, always document the things that you have done. And we have to remember that we write the SOAP again with the assessment and planning, so we know what we are going to do regarding the condition in the future. Then the very last part is that you will be asked to consult with the preceptor, head nurse, or clinical instructor about your decision to choose this patient, and then you have to make sure that they agree, and then you can do the application of nursing care and then help the patient to deal with the problem that she is facing. So I hope that you will have a little courage and confidence to be using this form. Feel free to ask questions, and thank you.